Hello.
Hi. Hi, I'm Shin. Nice to meet you.
Nice to meet you.
Yeah, I'm a PhD student of University of Maryland.
Oh, nice.
Yeah, so I'm really interested in this session.
Glad to hear it. How
hmm
far into your PhD are you?
Oh, now it's my second year.
Okay, so still early on.
Yes. So my research is focused on the geospatial health.
Oh,
It's
good.
like malaria, about the infection disease, kind of like malaria, avian flu.
Yeah, this will be a great session for you. Glad to hear that.
Yeah, I feel it still have some like similarity for this session.
hmm
Yeah.
Just give it another probably 5 to 10 minutes. I'm sure there's lots of people who are going to log in like right at 11 or even a little bit later.
Okay, yeah.
Hello, Dennis. We'll get started in just a few minutes. We're just waiting for everyone to filter in.
Okay, thank you so much.
So for everyone who has joined recently, we'll be getting started in just a few more minutes. Just giving everyone a chance to pop in because we know academics are not always on time. Great to see everyone. I think we should be having one other person from iGuide show up to kind of be a host, but also give the short iGuide spiel. So we'll just hang on a couple more minutes for them, and then if anyone else is still getting out of the previous meetings or whatever. I think we'll just get started. I'll just have to do the iGuide spiel. So for anyone not familiar, this is the iGuide VCO Virtual Consulting Office. And this is part of the iGuide project, which is the Institute for Geospatial Understanding through an Integrative Discovery Environment. This is just one small thing that we do. We have poster competitions. We have a forum, a conference coming up next month in Chicago, if you're around, which is also with the Sustainability Resilience Initiative Congress at SRI something, whatever SRI stands for. We also have summer school coming up, and we do that yearly if anyone's interested. To see the other VCOs on our website, iguide.io, you can go, is it in events? Yeah, virtual consulting office. Here we have other upcoming, but there are also all of our information for the forum that we do every year, the summer school we do every year. We've done mid-career workshops if there are any faculty interested in that. You can also give your own virtual consulting office if there's something that you want to present on. There's all sorts of stuff going on with iGuide. Everyone can see the screen correctly, right? Just want to make sure.
Yes.
Okay, thank you. All right, so I'll just dive in. The goal with these VCOs is to kind of be not just me talking at you, to kind of give it as a hands-on. So I'm going to have a few slides just kind of introducing the topic, make sure we all kind of are on the same page before we jump into the code. I don't want you to be lost from step one, and then if you don't have a background in coding, be completely lost. So just going to discuss a little bit about what spatial accessibility is conceptually, how we try to measure it, and then we'll jump into the actual code that we'll use to measure it. So why should we care about access? I think a lot of people don't realize how pervasive spatial accessibility and the broader concept of access is. Uh, Access to resources, you can calculate things like healthcare, healthy food, so food deserts, green space, but they're all really important factors in human health and well-being. There's lots of work showing this. Having access to essential goods and services also at the core of this 15-minute city push. This has been obviously very popular in the last decade or so. So having the things you need within 15 minutes travel time is accessibility. But it's also incredibly relevant to multiple UN Sustainable Development Goals, health and well-being, sustainable cities, etc. So I think a lot of people hear spatial accessibility, they think, oh, it's just, for example, access to hospitals or primary care providers are the two big common ones. But you can really calculate access to any kind of resource, and you can do it for a lot of reasons. There was an interesting paper that came out, I think, just this last month, where someone was looking at traffic engineering and rethinking congestion as lost access. So there's a lot of reasons to do this kind of work. It doesn't necessarily have to be healthcare, healthy food, which are probably the two common applications. So what is access? So this is broader than we're going to be talking about today. There's access and there's the subset of access that's spatial accessibility. But there's this great paper from 1981 by Penchansky and Thomas, where they outlined their 5 dimensions of access. So their 5 dimensions were availability, which is the relationship between the volume of supply and demand. Is there physically enough of that resource? Is there enough service providers to meet the demands of people? Accessibility, which is the relationship between the location and of supply and the location of the client. So if we have enough resources or enough service providers, but they're spatially mismatched, then that really doesn't matter. We need to make sure that we can bring this demand to the supply or the supply to demand, that they can actually meet up and work together. Accommodation, which is the relationship between organization of services and client needs. So you may have a good or service provider in your neighborhood, but if they can't accommodate you for some reason, maybe it's your schedule, maybe it's like disability accommodations, then it's not very much use to you. Affordability, this has been more and more popular because it's hard to get data on some of this stuff, but affordability, if you can't afford the goods or services in your neighborhood, especially like thinking living in the middle of a city, how expensive groceries are compared to like if you just go to the suburbs, go to a Walmart. And then acceptability, the relationship between the client's personal preferences / expectations and the provider's actual delivery. So A go-to example for this would be like maybe there's a grocery store right on your corner, but if you walk in and you see roaches all over, you're probably not going to pick up too much produce from there. So their access is a much bigger concept than we'll be talking about. We're mostly going to be focused on spatial accessibility, which is focused on those first 2 points. Availability, so is there enough supply? Is there enough service providers? And accessibility, the relative locations of supply and demand. Uh, the other flip side of this spatial accessibility, which is relatively common in geography, but we're not going to get too much into, I just wanted to give it a mention here, is this individual-based accessibility. So these 5 dimensions that we just talked about can be highly personal. Things like affordability come down to your household income. Things like acceptability come down to your individual preferences. And we can do access at an individual level to address them. So there's a lot of great work here that we're not going to have time for today, but space-time constraints. So Harvey Miller's space-time geography. Mapo Kwan has done a lot of great work in this space, looking at feminist geography and access. For example, they found gender differences in mobility patterns and time constraints. But even more recently, you could look at, for example, access to Spanish-speaking doctors. If you're a native English speaker or you speak the native language in your country, you might not think about this, but if there are communication barriers between you and your doctor, that's obviously going to hamper your ability to get accurate and timely care. And then even looking at perceptions of safety, there was some interesting work by Armida Carr and Harvey Miller's lab, looking at maybe the fastest route goes through a neighborhood that is perceived to be sketchy. So I'm not going to go through that neighborhood because I don't feel safe. And how does that affect your access if you're going the long way around, for example? So while this work is really interesting, it usually requires detailed individual level data like surveys and activity logs. So it's kind of difficult to apply and scale. So we're not going to be diving into that. But if at the end of this, you decide, hey, this isn't for me, I don't think we're really capturing what I need to be capturing, some of these papers, some of these methods may be what you need for your individual use case. But of course, what we're going to be focusing on is specifically spatial accessibility that attempts to quantify how accessible goods and services are when we consider the spatial constraints of availability and accessibility. Is there enough of the stuff that we need? And can the people who need it get to it? So the most common example for this use case is food deserts. We're looking for neighborhoods that have relatively low access to foods compared to the population. Well, healthy and cheap food usually for access for food deserts. So how do we do this? We're just quantifying ways to access critical goods and services across space. They're usually relatively simple metrics. This is kind of the result you get when you do this kind of analysis. So this is a map from this paper during looking at access to hospital beds during COVID-19, and you end up with a single metric. You can look at different metrics, obviously, but you end up with a measure of access. In this case, they just quantified from low to high. You can do that. You can use, depending on the metric, it may have its own interpretation where you don't just have to look at the quantile. But again, you can do this for a variety of resources. Healthy food, jobs is another very common one. If a community has low access to high-paying jobs, then that might impact the economic future of that community, but it also could have implications for the health, the safety, and other important metrics. And then healthcare, again, is another very popular, looking at hospital beds here. So when we're trying to calculate this spatial accessibility, and here we're pulling back to just thinking about the availability and accessibility, generally we need 3 types of data. So we need supply, where are the service providers or the goods? And generally this is a location, a coordinate, or a census tract, or whatever granularity we're using, and then a volume of supply. So in the last case, it was where the hospital is and the number of hospital beds per each hospital. We need a measure of demand. And again, this is location and volume. So we need, for example, for each census tract, how many people are there? It doesn't necessarily have to be the general population. There's lots of work looking at specific subpopulations. The paper reference a few slides back by Gil and Cozy looked, for example, at Spanish-speaking individuals. And then we need to look at spatial impedance. This is just a fancy way of saying travel time most of the time, but it doesn't necessarily have to be travel time. But it's the costs or barriers between the supply and demand. So how much work do I have to put in to go from where I am to where the resources are? And again, that's most often travel times, but there are some fancier measures that we won't get into. So these first two sets of data are generally easier to obtain. Supply, you can find, for example, federal database on where hospital beds are. You can find like lots of that data online. For some use cases, it's obviously a bit harder. Like if you really get into very specific things, for example, I'm sure looking up what primary care providers speak Spanish, that is probably going to be a little bit more difficult. But overall, it's a bit easier. Demand, obviously, you can get from the census, depending on what you're looking at. If it's measured by the census, you can get it from the census. Travel time is a little bit harder, especially if you're looking at non-standard spatial units. So if you're looking at something like a census tract, a county, a zip code, that might be easier. But when you start getting into these weirder spatial units, that'll be a bit hard. But you can calculate it yourself. We won't get into that today, but there are notebooks on the iGuide platform about that. So to try to build a bit of an understanding of what we're trying to measure, we're going to go through a couple of methods that we'll end up calculating in Python. But the idea here is just to kind of build an intuition for what we're measuring. So when you see the code, it hopefully makes a little bit more sense, and hopefully the outputs make a little bit more sense. So one classic method is the provider to population ratio. It's just asking the question, what's the ratio of resources to people within some bin, some spatial unit? So this map is from this paper, looks at the number of psychiatrists in rural counties per 100,000 people per county. This is really nice because here we didn't even need that third set of data. It's literally just supply divided by demand. I don't need to know travel times because we're assuming everyone's getting care within their counties. But there are some issues. So when you think about this metric, what are some potential issues we could run into if we're using this for policy implications? Do you have any thoughts from anyone? You can put it in the chat or unmute or however you'd like to share.
Uh, Alex, it might not be normalized. I mean, the population or area might have an impact and which might impact differently in different area. So,
Yeah, that's a great point. And that's why in this map, actually, you'll see it's rural. Because if you were to look at the ratios within urban counties, that would obviously throw this scale way off. Yeah, that's a great point. Any other thoughts on why we might not want to use something like this provider to population ratio? It's definitely an option, but it's not one of the things we're going to be looking at in our code later. Yeah, we could run into differences in like road access. That's a great point. So, um, road access. I guess could you elaborate maybe more on what you mean by road access here? Like just the quality of the road or and if there's any other thoughts, feel free to chime in. Hopefully, I know it's a bit early, but it's 11, so hopefully we're all awake. Humboldt County is 150 miles. Oh yeah. Yeah, so the size of the county, that's a great so counties are not like a standardized unit. It's not like a 1 kilometer by 1 kilometer. Having for example, psychiatrist here in my county could mean, from this example, 150 miles away. That's probably not a reasonable thing to ask for someone to drive 300 miles round trip to go see a psychiatrist weekly or however often they need. Yeah, it's a great point. But kind of the opposite is, do you have to go to something within your own county? Yeah. Yeah, the even distribution. So here maybe the issue is that the counties are too large. So within like a census tract, maybe they're more evenly distributed, but within counties, we know that often there's a rural center and then a lot of less densely populated, small number problem. Yeah, that could be an issue depending on your use case. But yeah, the assumptions within a county is another big issue. So it's not uncommon that if you need to go to, for example, a grocery store or a hospital or something, you can cross county lines, right? Like I lived in upstate New York, Chautauqua County. The nearest hospitals were in Erie County, Buffalo, and Erie County, Pennsylvania, where Erie, PA is. Like we didn't really have access within our county, but it was 45-minute away. So if you're not considering things outside of your county, you're going to run into some issues, especially for things like hospitals that are more specialized that you're not going to have in every county. Demand. Yeah, we could be looking at so here we do have a number of, we're using population as demand, and we have the number of psychiatrists as a supply. It's not perfect, but we do kind of have that. But yeah, because we're only considering within counties, we're not using any kind of distance weighting or
Yeah,
distance decay. Those are
you
great points.
you already alluded to it, Alex, when you were describing how your rural area and your clustering around your urban area. If you've got one provider in the center of that rural area that's got a whole bunch of demand, meaning population around it, that sort of thing.
Yeah, absolutely.
And the
Yeah.
rest of the county would, not have access to that one provider.
Yeah, very possibly. That's totally fair. So yeah, this is just to kind of get our brains flowing on our morning and try to understand what do we need to measure these things? Because if this is insufficient, what do we need? So the next measure we'll talk about is kind of the basis for most modern methods of accessibility, not all of them. It's the two-step floating catchment area, the 2SFCA. There's math, but I promise it's not too scary. The core concept, if we don't look at the map, at the math, if we look at this basic example, for every good or service provider, we're going to draw what's called a catchment. This is just a term that comes from hydrology, but think of it as the service area. It's not quite a service area, but it's our like estimate of service area. We assume people within our catchment will use our hospital. So here what we're going to do is we're going to get a ratio of supply to demand. So the supply at the hospital divided by the population at these counties. These are the counties that we're saying fall within our catchment because their centroid is within the catchment, or however metric you use. And then in step 2, because at the end of step 1, every hospital has this ratio of supply and demand, but that doesn't really tell us if I live in Humboldt County, what is my access? So then for every county or whatever spatial unit you're using, we're going to add up those ratios if I'm within a hospital's catchment. So here it's simple. There's only 4 counties and there's only one hospital. Well, within a catchment, there's only one hospital. But if you can imagine another catchment here, then this county is going to add up the ratio from this hospital, but also from that other hospital. And here we're just using the same catchments. So the other nice thing here is we end up with a ratio of supply to demand in actual numbers that matter. So here it would be hospital beds per person. Like it's an interpretable number. It's not just 4. What does 4 mean? Well, 4 here is 4 hospital beds per people or per 1,000 people. And we can give that to a policy expert or, for example, healthcare experts and get a response of, is that sufficient, without having the context of the surrounding areas. So this is kind of one of the reasons that this has been the basis of most modern, and because it's conceptually simple. We're looking at the people in the surrounding areas who we think we might use it. We're going to add up our resources. It gives us an interpretable number. Something like a hospital beds per 1,000 people may not mean much to the layperson, but it will to policy experts. The other really nice thing is that it's semi-local. So for example, if I'm doing a calculation within 30 minutes, my catchment size is 30 minutes, I only need to consider the things within 30 minutes. Something going on the other side of the country is not going to affect the measurement here, which means it's easy to do these calculations without worrying about, like, do I have a sufficient study area? Do I have to consider the entire US just to do one calculation for my neighborhood? But of course, there are a lot of improvements on this. For example, one issue here is that we have this hard line, this binary, you are in my catchment or you are not. So a lot of the work, and I guess beyond just within or without, where are you within? For example, these people are much closer to the hospital, obviously, than these people. So a lot of the work recently has been focused on trying to incorporate distance decay in reasonable ways, because you can obviously do like by house distance decay, but we don't usually have the data for that. So the enhanced two-step uses 3 travel time zones, or any number, but usually it's 3, of 10, 20, or 30 minutes. And then we have this discrete distance decay function. Usually it's applying a weight of 1, 0.68, 0.22, but there are a million variations for each of these catchments. So here we have maybe the 10, the 20, the 30, and then based on which catchment you fall into, when we do that calculation of hospital beds per person, we apply that weight. So here, this person's in the 10 minutes, we'd multiply their population by 1. This county's in the 20 minutes, we'd multiply their population by 0.68. And then this person's the 30 minutes, so by 0.22. And then again, when we do that second step of adding up per county, we apply those same weights. So the ones that are further out will have lower access. The ones that are closer will have higher. So it's the same core concept, just applying a basic distance decay function. But there are a million variations. So Wong 2012 showed that there's a general form of the function. So this is just that step 1, which is adding up the population and doing supply divided by demand, and then we just add it up for all the counties. This is very scary, I know, because we're using math, but it's the same function. It's just rewritten with a generic distance decay function. And we can apply, for example, that binary discrete. So you're in my catchment or you're not. We can apply that multiple. So here is 1, 0.68, 0.220, but you can substitute in any function you want here. And actually, the package we'll be using makes it pretty easy to do that when we get there. So the package we'll be using today is Pysal Access. I and iGuide are not associated with this. We're just plugging it because it's a great package, and we knew that it would be helpful to show how we could use it on the platform. This is the work of Saxon et al. They have a great paper talking about all of their choices in the Journal of Computational Sociology, I think. But the reference is down here. And their documentation is all available at pysal.org/access. And in just a few minutes, we're going to be diving into how we can actually use that to calculate access. But I guess before we move forward to the hands-on portion, are there any other questions, just so that no one's lost going into that part? All right, I'll move forward, but if you have any questions, feel free to ask or put it in the chat while we move forward. So what we're going to be doing, the hands-on, is on something called the iGuide platform. So I'm going to ask everyone to go to platform.i-guide.io. I just put the link in the chat. And when you get there, there's a login button at the top right. So the way the login works on iGuide platform, it's using something called CI logon. So you don't make an account through us. You choose your university, hopefully, is in this dropdown, but if not, Access CI, there's Google, there's a few options. There's Microsoft. So you don't have to register just by logging in through CI logon. That will register your account. So because I'm at UIUC right now, I'm going to log in there, and this will direct me to my UIUC login. So we don't see your passwords. You're not exposing anything. Okay, it automatically did it because I was already logged in. But yeah, once you do that, it's all through Google or UIUC, whatever university you choose in that dropdown. We don't see anything. And we wanted to do that because we don't want to be responsible for your passwords or anything. So I'll just give everyone a moment to get to the platform and log in and then get to the homepage. And if you have any questions or issues as we do this, feel free to ask. Or if there are any questions from the brief discussion at the beginning, you can also ask that here. Feel free. Maybe we give a thumbs up in the Zoom when everyone's logged into iGuide platform, ready to go. Okay, I'm seeing some reactions.
I have to shut down my company firewall to be able to do it, so don't wait for me. I'll catch up.
Huh, that's interesting. So on the iGuide platform, there is a contact us. Let us know about that, because if you're having that issue, it might be other people are having that issue, and there might be something we need to do to have it conform with the security requirements or something.
Okay, let me keep trying to make sure.
Yeah.
But it's telling me I have a firewall issue. But yes, I'll fill that out.
Yeah, and that goes for everyone. If you run into issues, we're always trying to improve. So feel free. There's a contact form at the bottom of the page if you ever run into issues. But of course, you can also ask here. It's extremely slow to load after. Huh. So, Henry, when you click login, is this page loading, or is the next page the issue you're running into? That, or maybe click login again, maybe it just didn't register. Because what we're doing when we log in is we're redirecting to cilogon.org. So, and then when you click login, that redirects you to whatever your organization is. But is anyone else having that issue? No, it does not redirect anywhere. Interesting. Maybe I'll pivot. Huh. So when you click login, nothing happens at all? That's very strange. Definitely, unfortunately, I don't think I'll be able to debug that right now, but definitely go to the contact form and let us know your username, your browser, everything else. Yeah, Amy, go ahead.
Yeah, so the first login step is working, and I'm logging in through my institution, and then it takes me to the big CI logon button.
Mm-hmm.
And then when I click that, it like tries to load a page. I get a header sort of thing. Or I guess I get the footer all the way at the top of the page, and then it comes back right back to that CI logon button. And if I click it a couple of times, then eventually it'll tell me my session has expired. So I got through that step that you're on right now just fine.
Which organization?
Cal Poly Humboldt.
Okay. I wonder if so the way this works, your organization's kind of responsible for, oh, that worked for me.
Yeah, so I did that and I logged in just fine.
Mm-hmm. But then the redirect back didn't work.
And then I get to the next page where I have this giant CI logon button in the middle of the screen, and then I can't get past that.
Yeah, so the way CI logon works, definitely fill out the contact form so we know about this, but
Okay.
it could be on our end. It could also be like each university is responsible for giving CI logon the required information to like do that to redirect. If you go back to if you could just go back to this web page, does it say you're logged in?
Back to, no, it still gives me a login option at the top.
Very strange.
And I started over. I, refreshed, went back to the beginning and started over, and I have the same problem.
Huh. Okay, yeah, I'll definitely share this because we've had a few VCOs and haven't run into this yet. So it might be a new problem that just popped up.
I switched over to a different access point and used the Google option to try to log in, and I'm getting that same issue where I just continually get back to the please click to log in. And if I do that, the same thing just happens over and over again. I'm not getting past that point.
That's too bad. Yeah, okay, I'll have to the developers aren't on the call today, but I'll definitely raise that with them. And then luckily all of these resources will be online. This video recording will also be online. So if you can't follow along today, we'll hopefully get this sorted out and reach back out to you, fill out that contact form, and then you'll be able to access all of this once we get it straightened out.
Thank
Sorry
you.
that it seems a lot. Yeah, it seems a few people have run into this. This is very strange. So if you were able to follow along, if you search iGuide or Pysal or Access, this is the notebook we're going to be using. In the way anyone who has an account can contribute notebooks to the iGuide platform. And just to show you, I guess, that process very quickly, it's just a relatively simple form. You put the notebook on GitHub somewhere, you fill out some basic information with thumbnail, and you put the link to that notebook. So the idea here is everyone can contribute their notebooks, their data, their publications, and link them in together. There's a, just gonna pull it back up. There's a way to put like related items so you can kind of show all the connections, because there might be some of us that are working on related things and we don't even realize it because we're in different publications, different subfields, etc. But yeah, once you get to a notebook page, there's a run this notebook. Go ahead and click that. It may require you to log in again to the Jupyter Hub. That's another glitch we're working on just to get them to make sure they talk together. But it should pull, what it's doing here is pulling that code from GitHub onto the Jupyter Hub, and then it should open like this. So I'll give everyone another minute. And I will log that issue with our developers while everyone's doing this part. Actually, I guess we can try. People who are having the authentication issue, try clicking that link. So it should redirect you straight to our Jupyter Hub, and you could try logging into the Jupyter Hub, which for now has a slightly different login mechanism, and then that might work and allow you to follow along with the notebook, even if the platform itself is messed up. Oh, good. I'm glad to. I guess it's a good thing we don't have the authentication talking to each other yet, because yeah, but we'll definitely get this sorted out. I apologize. All right. Once everyone's here, is everyone is there anyone here not familiar with Jupyter? Because I again, iGuide's a big umbrella. There's lots of people here who know coding, lots of people who don't. Just try to get a bit of understanding of where everyone's at, so I know where to spend the time. So in case you are not familiar with Jupyter, Jupyter is made up of cells. There are some cells that are Markdown, some that are code. You can run internal server error. Okay, sorry, looking at the chat. Failed to get username for CL logon. Oh, Eric Lee here. If you could check in the chat, there's some people reporting issues. Yeah, thank you for joining, by the way, Eric. But yeah, back to the Jupyter discussion with the time we have left. You can run a cell using this play type button. You can also do Shift Enter, and that will run a cell. Once the cell has been run, it saves kind of that in the Jupyter. So if I run the next cell, it will know the things that happened previously. Here, I'm going to clear the outputs of the cells just so we can get all new outputs. But this first cell, I'm just importing some packages. So I'm importing the access package, the Pysal access, but then also pandas. So this is a data frame. Basically, it's an Excel sheet in code. GeoPandas, which is like an Excel sheet with a location, a geometry, and then matplotlib is just the Python package for plotting things. So we're just going to run that. And then the access package luckily has a few data sets built in, which we'll rely on, so we don't have to worry about uploading data and doing all that. When you get to that step, though, you can upload. This is just standard Jupyter Hub. You can click this to upload files, and then you can just read them using pandas, GeoPandas. But for now, we're just going to use this. All of their data sets are from Chicago or Cook County, which is where Chicago is. So we'll just use this line to load their population data set and then their doctor data set with the geometries. So then we can do the head function, which just shows the first 5 entries by default. So this is what our population data looks like. We have these GeoIDs for tracks, the number of population in each track, and a point geometry. And then the GeoPandas package has a function called explore, which will create an interactive visualization. And since I said column pop, it'll color the map based on population. And this is interactive like web map. So if you saved this and like put it on a website, that would work. But this is also a nice just sanity check. Make sure that our data is in Chicago. It's not showing up in Antarctica or something, which means our CRS is all messed up. And then we can do the same process with the doc data set. It has both doctors and dentists. So we'll run that explore function on both of those just so we can see the distribution. And as a sanity check, make sure that our data sets are in the same area. Yeah, go ahead, Amy.
Sorry, my map's not showing. It says I have to trust the notebook, and it says go file trust notebook, and that doesn't exist in the menu. At least I'm not seeing it. So is it called something else, or is it in a different menu?
Did you run the cell or did you just open the notebook?
I just opened the notebook.
I think you have to run the cell to get it to recognize. So go ahead and click and then hit the play button so you get there.
Okay, it's giving me some errors along the way.
Interesting. Anyone else running into those errors? In the top right, does it say Python 3 0.9.4 where I'm right here?
Yes.
Huh.
Yeah, and you loaded which population explorer, right?
Yes.
Yeah, it's telling me that there's these variables are not defined.
So you have to make sure you run all of the cells above. So this will.
Thought I didn't. Let me start. Okay, let me start from the beginning. I thought I ran them all.
Yeah. I mean, a worst case, a nice little thing is restart and run all cells up here in the kernel, or you can do run all if that is an issue that you run into.
Ah, there it goes. Perfect. Thank you.
Yep. I'm glad to hear it's all working because if not, we'd have even more things to debug. So down here, we're going to load the network, and this is just the next cell after this. So here, we're going to load their SHI times, which is just their origin destination. It's a travel cost matrix at TCM. So for every census tract to every census tract, what is the cost? Well, not every, but every up to a threshold. I believe here it's 100 minutes. We have a cost, I believe, in minutes to drive, but actually on their website, they also have other travel time data if you're interested. So they have for a lot of major cities, but also a national data set for walking, public transit, and driving. So this is another great reason to bring up this Pysal access notebook and package. And then we can do the head again, just to make sure we look at the data so that we understand what we're doing when we call the other functions. The nice thing about the Pysal access package is that what you do is you create this access object with all of your data sets, and then you just call the function on that object because it already knows all of the data that you're going to be using. So we tell it the demand. So the data set we give it, this is the index. This is just the identifier, the GeoID. The value is pop. So the demand is going to be measured in population as the demand. We do the same thing with the supply. So we're passing it that shy doc. Again, the GeoID is the ID. You can also pass multiple supply values to get multiple measures, but if you just want to pass doc or dentist, that also works. For costs, we pass the Chicago Times data set. We tell it the origin is the origin, the destination is the dest. And the cost name is this cost field. So if you have a data set where like this is minutes or something, just change that around a little bit. And then these just allow you to look at, for example, if I want to consider, I can go to the doctor or the dentist from work. The Saxon paper has a great explanation of this. And then Saxon also has another paper on the rational agent access model, which we'll run in a second, that talks about this a little bit, but it's not super important. As you can see here, we're just passing in the exact same travel time data. You can do that. So the other thing we're going to do with this notebook is we're going to look at Euclidean distance. So if you don't have good travel time data for whatever you're working with, you can just calculate Euclidean distance, which is just as the bird flies distance to do this spatial impedance. So here we're going to look at the CRS, the coordinate reference systems for our data sets. We're going to project it to one that is more appropriate for our calculation. And then they have this function create Euclidean distance up to some threshold. This unit will be in whatever unit your CRS is. And then this is, are we going to use the centroids? Yes and yes, for origin and for destination. So we can run that. And then it'll automatically set this cost df function within our access object that we created. And we can see we have cost, which was our travel time data that we passed in, but we also have this Euclidean, which is just the measure we just calculated here. Any issues up to this point? And remember, you have to run all of the cells sequentially, because if I, for example, don't run this, then when this calls A, it's not going to know what A is. All right. Feel free to ask as we go whenever you run into issues, but we'll keep moving. You can also calculate weights. They have this weights portion of their package that we imported. So for the weights we're going to be looking at today, we're going to use relatively simple ones. So these are from the from here. This is this enhanced two-step weight. So we're going to do one that does 20 minutes, 0.68, 30 minutes, 0.22, and we're going to do one that just doubles the values. So out to 40 minutes, we do 0.68, and out to 60 minutes, we do 0.22. And we can run that to get our weighting function. But we can also calculate something more continuous, like a Gaussian weight function. Again, their documentation is great, so feel free to check out their website to see all the options. You go under API. There's gravity functions, step functions, and all of this is decently well explained here as to what the function does, how you, what data you give it, what data you get out of it, and then a basic example of how to use it. So down here, we can also create that gravity function. So we're going out to 60 minutes, and our distance decay, we're just doing distance to the negative first, which is 1 over distance. So as something goes further out, we decay it linearly. And then once we have our access object created, again, you don't need to do all this unless you want to use these weighting matrices. And you don't need to do the Euclidean part unless you want to use Euclidean distance. Now down here, all you have to do once you create the access object is you call the function that you want to calculate the access for. So this is going to be the gravity function because we're doing this weighted catchment. We're using that distance decay function. This is floating catchment, just a ratio. This is the two-step floating catchment that we talked about at the beginning. Enhanced two-step floating catchment using 2 different weight schemes. And then using Gaussian, so I guess 3 different weight schemes. the 3-step, which we didn't get into, but is another method that is based on the 2-step with a little bit of difference. And then this rational agent access model, which great paper by Saxon et al. Definitely check it out if you're interested. But essentially what you're doing is census tracts are trading off congestion, so the demand supply and travel time. I'm willing to go further if it means that the resource providers I'm going to have less demand relative. So once we run all those, we can run this, and this won't execute until the last cell is finished executing. So that'll help us know when all of these different calculations have been run, because we're doing 1, 2, 3, 4, 10, 11, 12 different measures. And these last two are the chunkiest. They're the most computationally costly because it's doing an optimization routine. And again, whenever you have questions or issues, feel free to chime in, because we're always looking to improve. So we need to know when other people are running into issues. We really appreciate hearing those. RAM. Yeah, so RAM is the rational agent access model. If you go on their doc website, it's right here. And they have actually a link to the, yeah, right here. Essentially what you're doing is you are, instead of assuming you're stuck within this catchment and you have all of the opportunities around you available to you, each census tract is choosing a specific hospital, or in this case, doctor, and they're doing a trade-off between the congestion, which is measured as demand divided by supply, and travel time. So yeah, this is the function. So this is demand divided by supply normalized by this rho term, which is just the average demand divided by supply, and then the travel time to the place normalized by tau.
This is online. Top article information. Share this page.
Looks like I accidentally clicked to have it read that to me. So it's a bit more complex than we're going to jump into too much, but yeah, the website, the Pysal website is great. They have explanations and links to documentation. So once that's all done running, we can do this. We're sorting by this RAM doc, and we're dropping census tracts that don't have a measure, and then we're just looking at the top few, so we can just see all of these different measures we calculated. And then here, we can just look at specifically, well, we can calculate RAM using Euclidean distance, and again, we can look at the output. And then we can also use this score function, which if we go to the docs, it just creates a weighted aggregate of multiple already calculated normalized metrics. So here we have this measure for doctors, this measure for dentists, but if we want to calculate a weighted sum of those, we can easily do that here in this package as well. And then this is just telling you how to set logging. It's not super important, but it'll help get rid of these info logs. And then down here, again, we can list all the different columns in our output. We can also calculate the correlations easily. This is the correlations versus that RAM. So we can look, we are getting very different measures. I mean, down here, the correlation between even just the doctor metric and the RAM doctor metric is 0.3. That's very low. So obviously there is a reason to use these different metrics. You are getting different results that are not strongly correlated. We can also plot that, so we can look at this nice, pretty correlation matrix. Something to note, RAM, because it's a measure of cost instead of access, is anti-correlated. That's why all these are blue and all these are red. We expect that. And normally you just flip it. You just negate the value to get your access, because the opposite of cost would be access. Again, explained in the RAM paper. It's a great paper if you're interested in going further into this. We can also create plots of our results. So this is just creating a plotting function, and then we can plot that RAM doc, and we can see there tends to be lower, again, for RAM, this is lower cost, so higher access in the center of the city. And then there's interesting patterns radiating out of the center of Chicago. But if we look at something like 3, we have higher access. Looks like higher access in northern Chicago, which makes sense. That's a relatively richer area, and then lower in southern Chicago, which is relatively poor. And we could even make like multi-plots, and we can save those results to a CSV. For example, if you want to export these results to go to an Esri product, or to just leave the platform and do more analysis. So yeah, that was a bit of a crash course because we ran into some issues along the way. I apologize for the speed, but this notebook and this recording will all be online, and I'll take the last 5 minutes or so for any questions or issues along the way. And I'll also mention that there are other access resources. If you go to our platform and you just search like spatial accessibility, there's a lot more results that you can look into, a lot more notebooks, data sets. So if this is something you're interested in, the platform is a great resource. But yeah, I'll just now open it up to questions, and then if you need to head out, feel free.
Thank you, Alex. Unfortunately, I was not able to log into the platform. I'm not sure if our institute blocks the access. But I do have a question about the future development for the platform. Do you have any plans to incorporate for example, the GTFS dataset to like describe the accessibility in a more realistic approach? Because now, like, you assume that there is this distance decay function, but doesn't include for example, the public transit schedule, etc.
Yeah, so this was just walking through the basics of the platform, but even on the Pysal access, these public transit schedules are based on GTFS. So there's lots of, we didn't develop this Pysal access package. We didn't develop these metrics. The platform is more for sharing data, code, notebooks, maps, etc. And this is one resource that's on there. But there is work in spatial accessibility looking at public transit. It's obviously relatively complicated because then you could get into, well, your public transit schedule is more probably busier during the day versus night. There's a lot of literature out there looking at exactly what you're talking about, differences in time, differences in public transit, etc. So yeah, it's a great point. There's lots of resources out there, but that's not exactly what the platform's focused on.
Okay, thanks.
Mm-hmm. But if you want to add those notebooks or add those data sets to the platform, we will welcome them.
Yeah, because currently I'm using R5R, like in R, to calculate spatial accessibility by different transportation modes. But it seems it's hard to scale up to, for example, to the whole nation, or even to the whole state. It's challenging.
Yeah, I've run into the same issue with R5R and Pi5R, yeah, or R5 Pi, whichever it is.
Yeah.
Did it all manually? Yeah, I can't imagine. Do you mean literally manually or like in an Excel sheet?
It was like built one step at a time in ArcMap.
Wow. Yeah.
Model builder. I used model builder to iterate it, but it was like, you had to generate each one of these layers and then generate your catchment, and yeah, took forever.
Oh, wow. Yeah, I can't imagine. I mean, obviously ArcMap has come a long way, so there are better options there too, but yeah, I definitely prefer the coding route, the Python and R route, and the platform does accommodate both Python and R.
Yeah, this is like months of work in like 5 minutes.
Yeah.
Kind of disheartening, but also exciting.
Yeah, it's good that we're making progress. It'd be disheartening if we all had to do that by hand every time we wanted to do these calculations. Yeah. Any other questions or issues? If not, yeah, all this should be on the iGuide VCO page. So for example, if you look at past sessions, oh, maybe we're a couple weeks behind, but eventually the recording will be on this iGuide VCO page. It'll just be this Zoom recording. And then of course, all these resources on the platform are just always available. So yeah, it looks like we're about 2 weeks behind. So should all be here soon. And again, you're welcome to use the platform for access or other purposes. We always have a contact form if you run into issues as well. Thank you all for coming.
Thank you, Alex. Fantastic.
Thank you.